Endometriosis is a condition that affects approximately 10% of women and an unknown number of gender diverse individuals. And an issue we see in endo is that the stage of disease or extent of disease doesn't often equate to the level of pain a patient is experiencing. So, the aim of our study was to validate our retrospective findings, which had correlated nerve bundle density or excess amount of nerve growth around endometriosis lesions to deep dyspareunia, which is pain with deep hitting penetration. So we did this by collecting tissue samples from patients' initial endometriosis surgery from the prospectively consented endometriosis and pelvic pain interdisciplinary cohort data registry from BC Women's Hospital. And we looked at nerve growth factor expression from within the endometriosis lesions, as well as peripheral nerve growth using PGP 9.5. And we found a direct correlation between PGP 9.5 nerve bundle density and patient-reported deep dyspareunia, which we did not see in any other pain type, such as superficial dyspareunia, dysmenorrhea, dysgeusia, or chronic pelvic pain. And so we're proposing that neuroproliferative endometriosis or neuroproliferative dyspareunia is a distinct biological subtype of endometriosis that presents with an abnormal amount of nerve growth around endometriosis lesions. So on contact, such as in deep dyspareunia, which is pain with deep hitting penetration, there is amplified pain signaling, amplified sensory signaling that leads to that experience of deep dyspareunia. It's really too early to say that um, we can apply these findings to clinical practice. But what we'd like clinicians to appreciate, or at least be aware of, is that there is a potential biological pathway that's leading to patients reporting deep dyspareunia. In our study, we had specifically determined those who had deep dyspareunia to present with preoperative, um, had their deep dyspareunia reproduced on preoperative pelvic exam by palpation of the posterior vaginal fornix. As well, we had excluded those that presented with bladder or pelvic floor tenderness as an indication for central sensitization. However, despite these findings, we know that deep dyspareunia or pain in endo is continues to be multifactorial. So a patient may have neuroproliferative dyspareunia, but may also have central sensitization or inflammatory components that are contributing to their deep dyspareunia. So again, it's a little too early to say what clinical features determine someone has neuroproliferative dyspareunia, but this all goes into developing stronger diagnostic criteria as we continue to research this condition.